Peace be upon you. Sometimes the patient's family comes and says, look, the treating doctors have decided on something called DNR and they're going to let the patient die. They won't give him any treatments at all, and if he dies, they won't do anything for him, the patient's family. And they did something called DNR. This is the topic of today's video. What does DNR mean, and why might people misunderstand this topic? First of all, DNR is a medical decision that a doctor uses. The treating doctor, along with two other doctors, makes this decision after assessing the medical condition of a patient who has an incurable illness. This decision is reviewed periodically. If things change or something new comes up every 3 months, every 6 months, whatever the interval. Secondly, after making the decision, the patient's family must be informed about the decision, and we tell them that the patient has become DNR. So what does DNR actually mean? In severe cases, if any illness or condition causes the patient's heart and respiratory system to stop while in the hospital, the doctors perform something called cardiopulmonary resuscitation, like we see, where they do a procedure on the heart called resuscitation, or they give the heart electric shocks, and sometimes they insert a tube into the windpipe and connect the patient to a ventilator in case the heart starts beating again. And the problem was with the respiratory system. After connecting the patient to a ventilator, we can say that the patient is still alive. We keep the patient in this state until we identify the cause of the problem and give them specific treatments, for example, if the problem is a clot. After performing cardiopulmonary resuscitation, we give the patient medications for the heart, put them on a ventilator, and administer drugs to treat the skin. Things start to improve. And after a while, we remove the patient from the ventilator and things get better. However, if the cause is something that is hopeless to cure, for example, if it is a very advanced stage of cancer, meaning a widespread and severe disease for which there is currently no available cure, and this particular cancer ultimately leads to either cardiac arrest or respiratory failure, then the situation becomes extremely critical. Even if we put the patient on a ventilator, and even if we give electric shocks to the heart and the heartbeat returns, and we put the patient back on the ventilator and keep them alive, there's really no point in doing that because I don't have a specific treatment. And of course, this is a decision made by the attending physician or the team of doctors when there is no particular treatment available. We can't offer any treatment for cancer at this final stage, so the patient's condition is terminal in this way, which has led to this outcome. There's nothing I can do to address the underlying cause. Therefore, keeping the patient in this state serves no real purpose and doesn't solve any problem. Of course, the first thing is that if I give a medication or perform a procedure for the patient that has no benefit, or if I do surgery for the patient, it would have no value, and I would only be exposing them to its side effects. This is the decision for a patient whose recovery is hopeless. If the terminal illness leads to respiratory failure or a cessation of breathing and the heart stops, then this is called DNR. This means that the entire medical team, including nurses and doctors, should know that this is a DNR, meaning if the heart stops or if there is a failure in respiratory function as a result of the terminal illness, not because of any other reason. We do not put the patient on a ventilator, and we do not insert a tube into the trachea and leave him on a ventilator. We do not perform electric shocks or cardiac resuscitation, meaning that these measures are of no benefit, as I mentioned earlier. The details are a bit difficult, and it's a bit hard for the patient's relatives to understand because the situation is truly very difficult for the patient's family. This makes it hard for them to understand what is actually being said to them. Sometimes we've already made the decision, and the matter is communicated to the patient's family in a certain way. Very quickly, they get the impression that we won't do anything at all, which is not the case. Of course, a DNR patient receives all the medications they need as long as there is no cardiac arrest and no respiratory failure. That means they can be put on regular oxygen and they can take antibiotics, painkillers, nutritional supplements, anything, any of the usual treatments. If they have high blood pressure, they can take blood pressure medication, diabetes medication, and everything else they need. On the contrary, sometimes the patient's condition improves and they are discharged from the hospital and continue follow-up in regular clinics, returning on their own. But often the decision is made and the patient stays in the hospital and receives all treatment. DNR includes a few other things. For example, like whether we will do dialysis for the patient. If kidney failure appears, no, we will not give the patient dialysis. medications to raise blood pressure if there is a severe drop in blood pressure or not. Should the patient be admitted to the intensive care unit or is it not necessary? There are some very specific details that the medical team decides, and of course, if there is a benefit, of course, we must do it. If there is no benefit, then we don't. And as we said, the medical decision is documented and made by more than one doctor. The family should be informed because often the family does not understand the situation and they tell you to do everything possible. We try as much as we can to communicate this to the patient's family so that they don't feel that the medical approach has affected things one way or another. By the way, you can subscribe to the channel. Watch, please, and like and support us for more content.